Welcome everyone this evening to the CWC ICC Cancer Forum. This is a session one of Decoding Global Breast Cancer and Other Cancer Related Challenges. My name is Vidyangi Patil, and I have been a CWC champion and patron for many years now. And one thing I know, and it has been hammered down time and again, is prevention is better than cure. Cancer is a word and it is not a sentence, says John Diamond. October is considered the Breast Cancer Awareness Month. And today, CWC or Crack the Wellness Code, along with ICC, India Community Center, have taken up this amazing initiative of bringing together experts in this domain to increase awareness about breast cancer. It is heartening to see that during the pandemic, there was a drop in the number of breast cancer screenings. A lot of women who would have otherwise survived cancer lost out due to a lack of screening and the lack of initiative and awareness in understanding breast cancer. Initiatives like this, which we host today on behalf of CWC ICC, are initiatives which will change several lives and help many people increase their lifespan. So, I would like to say pink is stronger than you think. So we have two amazing women here, and one of them has been a long term ICC wellness patron. So I would like to introduce Dr. Padma Srinivasan. She is a physician with special interest in lifestyle changes for better outcomes in cancer. She is a CWC doctor patron, and by profession, she is an internal medicine specialist and a nephrologist. Before that, the goal of today's session is to understand how to identify, as in, what are the different steps in identifying breast cancer so you can take charge of this disease at your home, at your doorstep, within the four walls of your comfort. We all know prevention and detection are so much more affordable today, and the only missing link is awareness. So, what are a few simple concepts we will discuss today? What is the impact of family history, risk factors? Also, did you know that breast cancer can occur in men? What is a mammogram all about? What is the limitations to it? What is the best course of diagnosis, treatment management, palliatives, and support groups? These are all a few questions which have clear answers, but some of them don't. And to wrap up, we would like to get some perspectives from researchers, solution providers, activists, and health heroes today. I'm so proud to introduce two amazing health heroes who have survived cancer, and they will be joining us today after the talk by the expert Dr. Lopamudra Roy. Before that, I would like to invite to the podium Dr. Padma Srinivasan, who will further introduce our guest of honor and speaker, Dr. Lopamudra Das Roy. Dr. Padma?
Good evening, everyone. It's my great privilege to introduce Dr. Lopa Mudra Das Roy. She's a distinguished cancer scientist, a research professor, and a social entrepreneur. She received her doctorate in molecular biology from University of Assam, and subsequently she did a postdoctoral fellowship in cancer immunology and therapeutics in Mayo Clinic, and also received an MBA from Kellogg School of Management in Northwestern University in Chicago. Subsequently, she joined University of North Carolina at Charlotte, where she was research professor. And with a grant from Department of Defense, she investigated cancer therapeutics and targeted therapy with focus on breast cancer and pancreatic cancer. She also received research grants from National Cancer Institute to be a principal investigator. Her research work is cited widely in several publications, and she's a sought-after keynote speaker. In 2017, seeing the global scourge of cancer, the lack of awareness, and the marked inequity in cancer treatment and accessibility to treatment, she stepped away from her very flourishing academic and research career and started pro bono this breast cancer hub, which has now grown from just being in India to being in Africa, some parts, and also in America, because lack of awareness and inequities in healthcare exist in America too. Breast Cancer Hub is very unique in that it adopts villages in India where the whole population is screened and given advice on screening, and people who have symptoms or signs are then guided towards treatment and are counseled. This is amazing work and it's very prolific also. Dr. Lopamudra Das is also unique in taking on male breast cancers because most people don't know about this, not only elsewhere, but even in America, it comes as a shock that men can have breast cancer, and they do. And another focus of Breast Cancer Hub is to break the taboo. The word cancer is horrific and it's a taboo, and the word breast is also a taboo. So she works hard at breaking these taboos. And Breast Cancer Hub has now grown beyond just breast cancer into various other cancer hubs, such as colon cancer, childhood malignancies, leukemia, lymphoma, cervical cancer, pancreatic cancer, etc. So Dr. Das Roy is so prolific in every undertaking that she has done. She is also she has also developed a program to encourage young people to become leaders in science, and kudos for that. So she develops future scientists. So thank you, Dr. Lopamudra Das Roy, and I invite you, CWC invites you to be our speaker today. Thank you.
Thank you so much, Dr. Padma. I mean, I was like, it's such a generous introduction, and I'm so humbled and honored to be here. Thank you. And I'm so grateful to CWC Forum for inviting me today. But I should actually also thank Radha Srinivasan, who was my summer student this year, who introduced me to Dr. Padma, and that's how I got connected to CWC Forum. So thank you so much, and it's an honor to be here among the other panelists, our health heroes who we are going to listen to after I complete my talk. So before I walk you through my presentation, I would just like to give a small story about what actually left a mark in my life. So I come from Northeast India, and I come from a family of physicians. My father was a pediatrician, so at home he always spoke about like breast milk to be the best immunity we give to a baby. So all this year, like while growing up, that's what I heard. There was no like it was always an open discussion. So when I was 12-year old, my one of my friends' mom died, and I went for the funeral. Over there, I asked like, how did she die? And even to utter the word cancer, it was a big taboo. So I kept asking then, like where the cancer developed, and the family didn't want to disclose. But when I insisted, they said breast cancer in a very hush hush way. So I repeated like breast cancer. They like, you're not supposed to talk about it. So I really felt very, it was so hurtful for me that one of my friend's mom died, and this is the respect you are giving to a mother. We lost her, that we can't even discuss about what caused her life. So eventually my career went into the role of it as a breast cancer scientist too. But then when I would be meeting the oncologists, they would always tell me that still, with the breast cancer scenario, the detection is late because women present so late. So that was the first, I felt that it's so important that we generate the awareness. We have to break the breast taboo and discuss more about it, because until and unless we translate the information to our community, because it's not only the taboo, it's the ignorance too, that women are not aware the painless or painful lump could be cancer. So that was the creation of Breast Cancer Hub, and now I'm going to walk you through my presentation so that we can get a consolidated idea that after our session today, each of us will be empowered and you can advocate yourself. It will be like a ripple effect. You break the taboo in your network, and you will be able to step up to help save lives. So that is the purpose of the session, so that it doesn't restrict over here, but it will be a take-home message, and it will begin in your own home. Now, before I go into the details, I always start with a tribute. So they are our breast cancer hub advocates, and we lost them in 2018 and 2019. So you see over here, Lotika Das. Her brother-in-law is my friend, and we grew up together in India. But her brother-in-law Shantanu lives here in Charlotte. So when actually the situation was that when he went to meet her, we understood that her reaction was she did not know that a painless lump in the breast could be cancer. So just imagine if that information would have been passed to her, then she would have been alive today. So you see here the women Manjit. I met Manjit in 2018 in August. The enthusiasm she had, she wanted to leave, but she was detected late. Then Janaki, they all had this enthusiasm to leave, and they are the fighters. So we always celebrate the lives of the heroes who left us because they are our inspiration to keep our fight going. Now, when we think of these women, we always, like when I first started Breast Cancer Hub, the reaction was that, yes, Lopa, you need to go to the villages in India. But then just imagine, they all are educated women. So the problem is not about the rural sector only. It's not only the financial constraint, it's the cultural, it's the inertia that we do not discuss any issues in the breast, and even the socio-economic condition, the education, irrespective of that, women give, that their health becomes the back seat. And also, even if we can financially afford, but we will not go for the screening. Screening means when there are no symptoms, we are going for a mammogram that I'm going to talk about. So mostly the detection is diagnostic. That means when we are having the concerns, we are going to the doctors. At that point, the tumors are pretty big and gets advanced. So the earlier we can detect, the better the prognosis is. So saying that, I would like to switch gear a little bit and go to the male breast cancer now before I go to the screening, because the screening that I'm going to talk about is applicable for both women and men. Now, according to the statistics, we all know that whenever we think of breast cancer, we are thinking of pink everywhere. But I always say that let's bring a touch of blue also. So that's why our logo always has a streak of blue in there, and four ribbons together means we all come together to fight for the cause of cancer. Now, with male scenario, the situation is worse than women because men feel it's a woman's disease and they are more shy to talk about it. So, for example, one of the stories I heard in the men scenario, he told me that he didn't, his children did not even want to tell their friends that their dad has breast cancer because their friends are going to laugh at them. So that is so sad. And one of the person from Nepal, he reached out to me saying that I really want to work on male breast cancer. And when I asked the reason, he said, my senior in school, he was 18-year-old. He was detected with breast cancer, and everyone started to make fun of him. It was a taboo, and then he committed suicide. So we should not ignore the male scenario. So that's why, I always, so we from Breast Cancer Hub, we collaborate with Male Breast Cancer Coalition. And if you see Brett Miller here, the picture, he fell the lump at the age of 18. So that means that we really have to, do the screening process for the men. It's not only that later in the age, but young men can also get breast cancer. The other situation here, I want to give an example of Marlene Washburn. His wife, Patricia, is right here next to me. So Marlene was fighting for breast cancer for his daughter, but he did not know. He was a principal in the US in a school. He was super educated person, but he did not know that he was having breast cancer too. When detected, we had him only for 5 months. So this is the scenario with male breast cancer. We are doing a lot of study now on the male breast cancer research, because with Breast Cancer Hub, the other intent is to bridge the gap. Wherever I see the challenges, we're trying to go into there, because whatever research we have been doing in the lab, we are always doing on the female transgenic model, the preclinical study, the clinical study. And what is happening is with the male scenario, the recurrence, the treatment is not as much working because we are using the same treatment that we use for females. We are using it for male, but there are a lot of hormonal changes. There are a lot of other factors, that play a role. So that's why, we always bring in the male scenario equally as we talk about the female, though the frequency is 1 out of 833 men. But I always say that that man is a father or a son or the brother of a family. So how can we ignore them? Now, next we will go to the screening process. But before that, I also want to share, like, how do I know that, what are the basic challenges which is being faced? So what I did was I went through all across India. I was meeting all the survivors or the patients. And what I understood was that lot of times the impression was that no one in my family has breast cancer. So why even, like, for example, this woman here, she is a school teacher, and she told me that she felt the lump for a long time, but no one in her family has breast cancer, so she totally ignored. So the other scenario that I faced was that, the same thing, that I was so shy to tell anyone. So that's why I did not want to disclose even to my daughters. I have two daughters, but still I didn't want to disclose. So these are the different things going on. So from today, after today, I would request, like, please take the phone call. If you are from the US, your family is in India or other countries, tell your mom, tell your aunt, tell your grandma to do the screening process. Even when, if you're a son, you have to speak up to your mom, or, just don't be shy, because that's the first step. Now, what is the statistics, right? So the statistics goes like this. That is, we all know 1 in 8 women can get breast cancer in their lifetime. But then, as Dr. Padma said, that it's not only in the developing countries. In the US also, it is very essential, because according to the American Cancer Society, we are still expecting this many deaths, estimated death to breast cancer. That means the situation is pretty grim. But then we all know that in the US, the early detection is significantly higher than the developing countries. And also, we should be knowing that we all mostly go for a mammogram, which is the standard for breast cancer screening after the age of 40. But then why, there are still late detection, or what actually happens? Why the progression of the breast cancer from early stage to the late stage? So I'm going to touch a little bit over this challenges too. But in the developing countries, the death rate is significantly higher. Now, when I say that, when I'm looking up for the data on the internet, what I find is that 60% is the survival rate in India or in other developing countries. But when I'm actually going to the rural sectors or many repositories in the urban sectors, I see like it is 90 to 95% death rate. But where is this data represented? So what I'm trying to say is that what we see actually representation with the breast cancer scenario may not be the true depiction. So that's why it's alarmingly increasing, and not only in the older population, but also nowadays in the younger population, breast cancer is significantly higher. So, but when detected early, breast cancer is totally curable. So what is the detection process, right? So that is what we are going to talk about, the breast cancer screening. Now, this one particular slide, I tried to compile everything, and then I will go into the challenges again, like limitations to mammogram. But what is the screening process? So from the age of 17 to 18, we really have to do the breast self-examination. That means that we have to understand, and I'm going to walk you through how to do the breast self-exam. We have to understand the look and feel of our breast to detect any abnormalities. Basically, like, for example, how do I know how many white strands of hair I have? Because I am observing. In the same way, we have to be very vigilant about the look and feel of our breast. Now, that goes as the self-breast exam. But then, what is the standard? The standard says that we can go for mammogram after the age of 40. That means from the age of, like, when I turned 40, doctor gynecologist told me you have to go for mammogram. I started to go for mammogram. Like, it is my choice from the age of 45 to 54 every year, and 55 and above every 2 years. But then what happens to the younger population? And even when we have mammogram is once a year. But then a lot of women, they told me that they had their mammogram and they were so relaxed and relieved that, they don't have to worry. But then they felt a lump eventually in 6 months. So what I'm trying to say is that for the population, younger population or the older population, we have to do the breast self exam every month. And then we also have to go for a physical. That means we go to the doctor and the doctor does our clinical breast exam, which is very significant and important because this helps to detect many lumps. Now, saying that, when I'm talking about the developing countries, and I told many doctors in India, so many gynecologists who are women, they told me that this is the reaction. Why are you touching my breast? Nothing is wrong in my breast. I came for a situation in my reproductive organ. And the male doctors told me that it's very difficult to examine a woman's breast when they have come for some other concern. So that means that there is a cultural stigma over there. And my point is that we cannot complain all the time and we cannot break this taboo in one single day, but we have to provide a solution. That's what I'm going to talk about. But before going that, I also want to mention that though the protocol, the standard is that above 40 we have to go for a mammogram, but what happens to the population who are at high risk? That means that they have a family history of breast cancer. So do we ignore them totally, or what do we do? Because mammogram at the age of 40 may be too late for them. So who are at high risk? So that is very important that we understand the genetics of breast cancer and ovarian cancer too. So when in a family we have breast and ovarian cancer running, for example, the first relative like aunt, mom, grandma, or the cousins, then what we do is we call this as mostly the hereditary breast and ovarian cancer syndrome, and we go for the genetic testing, which we call as the BRCA1 and the BRCA2 mutation testing. Now, when I say that, 5 to 10% of all cancers are inherited. That means 80 to 90% randomly this can happen to anyone. So it's not that, if I'm not having anyone in the family, I shouldn't worry. I should be concerned at all conditions. Now, when I'm thinking about the genetic mutation, the problem that I see is we are always thinking about the females. But we cannot forget the males, because the father can also be the carrier, or they may be expressing the genetic mutation of BRCA1 or BRCA2. And this can be carried to like 50% chances to the son, or it can affect the daughter also. So it's very important that if you know anyone having a family history, we should always recognize the man also equally as we recognize the daughter. We should also recognize the son to go for the testing, because that boy may not only be susceptible to breast cancer, but also to prostate cancer, pancreatic cancer, and other types of cancers too, so because they have the promoter now to develop cancer in all these organs. Now, is it only sufficient with the BRCA mutation? So I have seen many cases. They told me that, I'm so relieved my BRCA mutation is negative. But we should also know there are other high penetrance genes also. So I have stated over here, and there are moderate penetrance genes. So I always request everyone to do the panel, because when we have this moderate and the high penetrance genes beside the BRCA mutation, we are susceptible to breast cancer. So that means that population is vulnerable. For the male scenario, what are the reasons they can develop the breast cancer? So of course, the BRCA mutation, the high penetrance and other moderate penetrance genes, but there are other risk factors, for example, the aging, the radiation exposure, because, I don't know if you know this area in North Carolina, the Camp Lejeune, there are a lot of, there was a seepage disaster of arsenic radioactive materials which caused cancer in every household almost. And then many have developed breast cancer. Also, there are many men I know developing breast cancer who work in the atomic like industry places. So what I'm trying to say is radiation exposure is important, that man may develop alcohol, consumption of alcohol. Some liver diseases are also leading to breast cancer in men. Hormonal treatment, obesity, which causes underlying inflammation, can also lead to the breast cancer. Testicular conditions, guys, then also the gynecomastia when the males have more tissues. And there are other two signs which are called the Klinefelter syndrome and Cowden syndrome, which leads to the development, they're at high risk for male breast cancer. So it's very important that if you know this population, that we please become aware. And of course, this is the family history, the genetics, but also the other situation with the male breast cancer. Now, so these were the high risk population, right? So for the both females and the males. Now I'm going to talk about the screening that we always know that the gold standard for breast cancer screening is the mammogram. But then did we know that mammograms can also miss breast cancer? So she's Dr. Nancy Capello. She did her mammogram in the year 2004, and her mammogram came as a happy mammogram. There were no concerns. Now, one good thing in the US is that we go for a physical in the same way she went for a physical. Doctor did the clinical breast exam, and they felt a big lump. And then when she did MRI, it came as stage 3C. That means it was pretty advanced. Now, her situation was she was so upset. She said, "What happened? I did my mammogram religiously, and the doctor said you have dense breast." Now, because of Dr. Nancy Capello, we lost her in 2019, but because of her, now all the states in the US, we get this letter that what kind of tissue we have. So what is this dense breast and why I'm talking about this? Now, this is the mammogram, which is the low dose X-ray of the breast. Now, here, when we have our breast mammogram or the X-ray, it usually appears as a black background like this because our breast tissues are made up of mostly fatty tissue. But, we women, we 60% of the chances times, we also have, in addition to fatty tissue, fibroglandular tissue, which we call as dense breast. Now, when we have dense breast, it appears as a white patch like this. And when we have heterogeneous dense breast, it's scattered, and homogeneous means it's totally dense breast. Now, why am I talking about this? Because when we have cancer or lesion, it appears as a white spot. It is basically finding a snowflake in the snowstorm, and that's how we can miss the cancer. So what are the additional tests? Like, for example, what I'm trying to do is working with the healthcare system also now, if we can make some changes to the healthcare policies. Now, in the US, the regular mammogram is becoming redundant. So what we are doing is more on the 3D mammogram. 3D mammogram or tomosynthesis. That means that, when I would request, when you're going for your mammogram, you hit the age 40, you go for mammogram, please request the doctor, the radiologist, if you can go for 3D mammogram because it gives better resolution so that you can diagnose dense. So dense breast, we only know through mammogram, but 3D mammogram is a better resolution. But many times 3D mammogram can also miss it. So at that point, what is an additional test? We can do breast ultrasound or MRI. So this particular slide has saved so many lives in the US and in wherever globally I'm doing webinars every day. And this is an eye opener because many patients told me that they were feeling the lump growing, but the mammogram came as negative, and then they pushed towards ultrasound and it came as positive that they were having the tumor. Because in India, for example, if I'm talking about mammogram and if I talk about 3D mammogram, that's not as much applicable. So when I'm talking, I have to think about all the scenarios. At that point, I tell everyone, when you go for your mammogram, ask your doctor if you have dense breast. If you have dense breast, additionally, you do an ultrasound. And the doctors are actually stepping up and doing both in parallel, so which is really, really helping. And in the US, that is what I tell that, because mammograms can miss 50% of the cancers if we have dense breast. So better to go for 3D mammogram. And in addition, ultrasound, if you really think that, we are not getting a clear picture. So, but then what happens? So this is what in the research scenario, I'm not going into details. These are the different areas I'm trying to tap into so that bringing into the limelight, what is actually happening in the US. What are the reasons why we are getting late detection and also why the cancer is progressing. So, and this was one of the reasons that we figured out. Now, but what happens to the younger women, right? Because in our support group, in our BCH support group, or when many women reach out to me, most of the time I find that they are very young, like 35, 37. This is a very recurrent age that I'm seeing. But what do we tell them? And also, when in urban India, when I thought of first starting breast cancer, my point was that if I'm going to these different places and I'm using this big versus mammogram, this will never work. So I have to give a solution. So that's when I felt that whatever the doctors are doing, the clinical breast exam, in the same way, we collaborated with the Sarah Cannon Cancer Institute breast oncologist and Male Breast Cancer Coalition. And for the first time, we brought a breast cancer self-breast exam card for men and for women. And this is in a very simple way, like how we can save ourselves. And this is the simple step that you need to practice at home. Now, when doing that, my concern was that, I'll talk about it, like if I'm going to the villages and I'm giving it out in English, this will never work. So I'm so thankful to our Breast Cancer Hub volunteers for helping me to translate this. Now we have it in 24 languages, and this works like magic. But then how to do the breast self exam? Is it that, I suddenly remember today and I'm going to start doing the breast self exam? That shouldn't be that shouldn't be the case. So how do we do it? Basically, 7 day post our menstrual cycle. Like if we start our period today, 7 day from today, we have to do a breast self exam. Now, and for the women who hit menopause and for the men, we just pick a date in the month and we do the same practice the next month, the same day. Now, in a sitting position and in a sleeping position, many breast cancer survivors told me that, like the heart floor worked very good for them. So what do? We stand in front of the mirror, we take our hands behind our head, and we look for any abnormality, any discharge from the nipple area, any swelling around the nipple area, any parts like any redness, any pimple, inverted nipple, like if there's a sudden change, sudden inverted nipple, then skin irritation or dimpling of the skin. Like for example, if you know the orange, like the skin of the orange is dimpled, so something like that suddenly happens, or redness, scaliness, or thickening of the nipple area. So these are the concerns. If you feel something like that is happening, immediately report to the doctor. The next thing is we take our hand behind our head and we start to examine from top to bottom. We have shown this in an arrow, but we also have to remember that the collarbone area and the underarm area, which is very important. When we are talking about breast self exam, it's just not the breast area, but the full chest area. We really examine it very well. And what do we expect? If you're feeling something like a marble, like a mustard seed marble is slipping from a finger, so do not panic, because 95% times it will be benign, which is non-cancer, but 5% times if it is cancer, it's always better to be safe than sorry. So we just wait for a few days, and if we see that no, the symptoms are not going away, the lump is becoming sturdy, we immediately report to the doctor. We go, if we are young, probably they will do the ultrasound, then we do the imaging. If we have dense breast, we have to do additional ultrasound. So this is the protocol, and this is saving innumerable lives, because we have different proof, like for example, in India, this works like magic, because wherever I'm going, for example, this is in Hyderabad, this is in Chennai, this is in Assam. The breast self exam card in the local languages, women love it, men love it. The other thing is taking accountability, because I do not believe just going and giving lectures, because everyone should be able to reach out to us. So I give my WhatsApp number to everyone. That works very well, because WhatsApp is free all the time. And then but those who can email me, they have my email addresses, and the villagers will not have the phone, but the organizers have the phone, so they have my number. They reach out to me, I navigate them towards the hospitals, so that if they're below poverty line, then the government aid comes in. But to the diagnosis time, we try from Breast Cancer Hub to help them even with the diagnosis part. So this also works very well in the US, in Africa, because in the US, these outreaches are done mostly, as I said, by our community leaders who are the students. They are talking about the early detection, the screening processes, and then of course, like, we take accountability. We work in the shelters in the US, and we work, so basically, connecting to the healthcare system, where I'm working with them so that these patients can get treatment very well. Now, this was about the screening process. Like, now we know that what are the different screening. Basically, if clinical breast exam, we have to go to the doctor, do the breast exam every year, once in a year. We have to do a breast self exam every month from the age of 17 to 18. We have to go for a mammogram. If we have dense breast, we have to do additional screening. For the high risk population, we have to do the screening earlier. And that is the key, because early detection is the key to saving lives, because the stages of breast cancer are stage 0, stage 1, stage 2, stage 3, stage 4. From stage 0 to stage 3, we can cure the patient. But if it goes to stage 4, it becomes very difficult. That means the cancer from the breast, it has spread to the distant organs. So, but from stage 0 to stage 3, we can cure the person. So it's important that we detect, and the earlier the stage is, the better it is. So that was the screening, and now I'm sure you are empowered to know how to do it. Please download the breast self exam card and share it in your network, so that you can also take step up to help save lives. And then from now onwards, after the screening process, I'm going to talk a little bit about palliative care and the importance of the support group. Now, this is a story in a village in Assam, and I'll wrap up in another 10 minutes for sure. So this is a village in Assam. Like when I went, someone told me like we have a stage 4 breast cancer patient and we lost this woman now. When I went, I saw that, she was lying on the floor and her family was isolated her totally. So what I felt then, what they knew was cancer is contagious. So this small information, what I tell the doctors now, that when you're talking to the families, talk to the caregivers because they have no clue what cancer is. And that is the counseling that we are trying to do in the villages we adopted, plus also, even in the urban sector. So for her, we took her to the bed and gave her comfort. But most importantly, I told the son and the daughter that this is not true. And then, after months, they hugged her. And that one, the smile that she gave me was my biggest reward. We lost her, but she knew that she died in the arms of the family. Now, this is important to know because the concept of palliative care is significantly missing in many parts of the world, because when we think of palliative care, we think it's at the end stage. That's not true. It should start from the beginning with any diseases, any chronic disease, and of course with cancer. Now, when I tell this story to many places, many breast cancer patients told me that, you're talking about the villages, Dr. Lopa. I am a breast cancer patient. I feel the isolation. One lip cancer patient told me, I am a survivor for 5 years, but I can feel that, when I go to someone's house, they are hesitant to give me a cup of tea or water. That is so unfair. So what happens is when we are detected with cancer or any diseases, the bridge is shaking and we need to give that support. And the support shouldn't be only coming from oncologists, from anyone like friends, but it also, the most important role who play are the support groups. So that's why, while I was going through all these places across India, I felt that many women told me, what is a support group? And that's where regionally we have, like in the villages, we have developed many support groups, but also we have a very, and I have the pictures of those who've given me the permission. So we have very close a WhatsApp group, a very private WhatsApp group, and our health heroes who are going to talk today, Anusha and Laura, they are integral part of the WhatsApp group. And the amount of support they give to each other, me as a scientist, there are oncologists in the group, we cannot do the medical touch that our survivors do to the patients. So the support group is so important. And like for example, while talking about support group, I just want to touch base a little bit about the story of Christina, a very good friend of mine. And she felt, so the reason why I bring her story is she detected her lump through breast survey exam. That's why this particular paper is not just a paper, it's a lifesaver. And what she told me was that who gave her the strength? Her kids, because they would wear this t-shirt, strong like mom, and they would come in front of her. And hers was an aggressive type, but she told me that, Lopa, I couldn't fail because my kids were my biggest strength. So many times I find that many moms are hesitant to discuss anything with their kids. Don't do that. Your kids are your greatest supporter, and when they're with you, no one can stop you to fight cancer or fight anything. In the same way, Jessica, she did her breast self exam and found her lump. And the other, the taboo and myth we have is when we are detected with cancer, our life is over. Many marriages I have seen to be broken in India and even in the US. But this woman is such a brave heart. When she was going through her chemo, she got married the day her marriage was fixed. So what I'm trying to say is everything is possible. Cancer is curable when detected early and treated accurately. And that's the strength of the support group. Now, I'm not going to go into these slides, but I'm just talking about the villages we adopted, going door to door. We take care of everything, because these people are so poor. For them, food is the priority, not the like treatment. So we take them to the hospital, make their treatment, make sure they're getting treated, then counsel them. So we are very proudly, we can say that from zero awareness, now this 11 villages are 100% aware, and not a single person is detected late. So BCH is the pioneer to do this in India, going door to door and helping the women and men, of course, with all the type of cancers that we branched out. And we also help with the financial aid, whatever little revenue that we have, because with us, 100% goes for the cause. Now, that was the screening, and I'll just touch base now with the key risk factors with breast cancer and other types of cancers. So coming from screening to palliative care or to the support groups, and that's when the early detection is the key. We understood that, but then prevention is always better than cure. Now, one important thing that I want to bring up that we always ignore is inflammation. That means that, my work on arthritis and breast cancer, like I discovered the mechanism that when we have arthritis, which is the inflammation of the bone, and if we have breast cancer, the metastasis is significantly, the prognosis is bad because there are many pro-inflammatory cytokines that are counteracting. Now, the reason why I bring it up, because when we have cancer, and if you're having any other inflammatory condition, we always ignore that. It acts as a fuel in the fire. So please don't ignore that, because inflammation is really like it helps in the progression of cancer. So please combat that inflammation. The other key risk factors, family history, I have already mentioned, radiation, the UV, then the environment, occupational hazard. Then most importantly, like three important things I always say is tobacco, because tobacco smoking is also leading to high risk with the breast cancer scenario in the younger population. Then the lack of exercise, because a lot of times now, as CWC Forum focuses on lifestyle with the music therapy and all of that, is so important, because exercise plays a very significant role to boost the immune system, to decrease the stress level, because stress is also another reason which kind of, with the different upregulation of different oncogenic signaling pathways. So all this, so basically when we think of prevention, it's multidisciplinary. We cannot just ignore one thing and we say that, okay, I'm exercising daily, but I'm also smoking. So that wouldn't work that way, right? So we have to take care from all angles. We have to take care of our weight also, because overweight, obesity also leads to underlying inflammation. Consumption of alcohol leads to underlying inflammation, which are all finally giving rise to the risk of breast cancer or any type of cancer. Now, one very important thing is the post-menopausal, hormone replacement therapy, which usually when we hit menopause, many times women are given the HRT treatment. So I would request that please check with your doctor, because now we are seeing that in the long run, the usage of the hormone replacement therapy may also lead to the risk of developing breast cancer. So these were the key things. But most, of course, like 30 to 50% of the cancers can be prevented if we take care of all of this. But most important, as Dr. Padma initially was mentioning, that the lifestyle, the diet, because what happens is that if we think in a scientific way, inside our body, there are free radicals generated, and these free radicals will go and damage the DNA of the cell. And which kind of like, when the DNA is mutated, of course, it leads to the abnormal division of the cell, leading to the tumor. But antioxidants will help to balance the free radical, and so that it stabilizes and is no longer available to go and damage the cells. Now, who provides these antioxidants? Endogenously inside the body, there are many mechanisms. Food also helps. So when we think of food, and if we are thinking of a developing country, we will not find berries and all of that there. But we know that we are living in turmeric, like turmeric, which is the byproduct of turmeric curcumin. When we have it with pepper, it really helps as a very good adjuvant. Now, I'm not saying that, if we have turmeric, it's going to cure cancer, because then no Indians would have had cancer, because our diet is rich in turmeric. But it helps as an antioxidant. Fresh ginger, fresh garlic, fresh onion. What we are seeing is that now a lot of times we are using so much of paste, because of our life is so busy. We try to go with the shortcuts. But I always say that our Indian spices are so good. Let's just take advantage of it. Even in the US, we can just make it, quickly in the grinder. Make those spices, just use it in your curry, use it in your day-to-day life. That really helps, because these are rich in antioxidant. So this was about the inflammation. These are different food that carbs inflammation. I just touched base, but food aggravating are the sugar, saturated trans fats, omega-6 foods, and refined carbohydrate, all of that. But most importantly, what I want to say is that lifestyle definitely plays a very important role. But then a lot of women told me that, Lopa, I did everything right, but why did I have breast cancer? The answer is we do not know. There are significant things which are still missing, but whatever is best to our capacity, we need to do that. Because when we have a healthy lifestyle, even when we have cancer, at that point, it becomes easier for us to understand and to take the treatment, which is very aggressive. That way it becomes easier for us with our immune system to fight with the treatment process also. So this was about the breast cancer, the full scenario, the full picture. And I just had a slide about all the other types of cancers. I'm not going into detail now, but I want to tell everyone that from Breast Cancer Hub, we have actually generated early detection cards for all other types of cancers, where we give all the signs and symptoms, which are alarming. And we also have like what next, like if you're feeling the symptoms, what you have to go and tell the doctor. So basically advocating for your own health. And this cards, please download it, because mostly for every cancer, the signs are there, but we miss it. And because of which we are detected late. So please don't do that. Download the cards and circulate in your network. So I think I'm running out of time, but Dr. Padma wanted me to mention about the students. So I just wanted to show a few slides, like how in the US, I'm mentoring many students, and even in India and other countries too, where they are the torch bearers, and they will lead the efforts, about early detection and prevention of cancer. So basically, I always say that when a lot of people ask me, like, how do you differentiate, Lopa? So we say that, Breast Cancer Hub doesn't have to differentiate, because we are fighting for the cause of cancer, which is much bigger than any uniqueness. So why can't we just come together and work for it? And that's why I'm so thankful to CWC Forum today for inviting me, Dr. Padma, Somnath, Somya, Vidyangi. Thank you for moderating the session, and especially Radha for connecting me to CWC. And thank you everyone for listening me today. I hope you will take it home and practice all this, whatever I have said, the information. Thank you so much.
Thank you, Dr. Lopamudra. I could not have asked for a more enlightening and a more heartfelt talk here. You're truly in the element of this disease. You're out there to, get to the roots, and you covered so many aspects of the, awareness which women and men both are entitled to. With that, I would like to call on Dr. Padma Srinivasan to introduce our health heroes, and let's see what your journey has been like. Dr. Padma.
I truly appreciate, and CWC appreciates, the health heroes who have come forward to join, to tell us about their journey. So many people clam up when they discover they have cancers. They become shy, they shut out others. But people who reach out to help others are true heroes. And I really salute Anusha and Laura. And Anusha is actually 3 hours ahead. Now she is in Atlanta. So, and in spite of this fatigue of being close to midnight, she is staying up to talk to us. I truly appreciate Anusha. So, brief introduction. Anusha Mishra was diagnosed with stage 3 breast cancer January of 2020. She went through chemotherapy, multiple rounds of surgery, and radiation therapy. She's currently on targeted therapy as prophylaxis, and she's so courageous and also staying up late to talk to us. Thank you, Anusha. Please go ahead and share your story with us.
Thank you so much, Dr. Padma. Hello, folks. My name is Anusha, and I'm happy to speak with you and share my experiences and thoughts. I was diagnosed with advanced stage 3 breast cancer in January of 2020. I went through 8 rounds of accelerated chemo, 3 surgeries, 25 rounds of radiations. It was a life-changing journey for me and my family too. My lessons and realizations from this journey is what I will describe today. Number 1, become an advocate for the reason that got your diagnosis, being early or delayed. Like in my case, the cancer was caught in stage 3 because of my dense breast. So I strongly advocate for ultrasound along with mammograms. Number 2, get physical and emotional help from family, friends, and community. Their support will make you feel loved and needed by all. This gives a lot of strength to carry on despite all the challenges and pains. Treat your body and mind as your most precious possessions. A healthy body can help you cope with the side effects of treatment in a better way, and a healthy, positive mind will help you maintain your sanity during this tough journey. Last but not the least, join a support group. Yes, I'll repeat again and again. Join a support group. The support group will help you answer most of your treatment related questions. The feeling that there are so many people like you who are going through a similar journey gives you a lot of strength and hope. You will find empathy in a support group because the people there are understanding your aches and pains because they are themselves going through. So for me, Dr. Lopa and her breast cancer hub have been a huge, huge blessing as I find support and answer to all my concerns. Another biggest thing that I realized during my journey was do your homework. Whenever you have any doctor's appointment, any visits with your oncologist or the breast surgeon, just read. There are a lot of good websites online that give you good information because the doctor is going to present you with a lot of treatment options and you will have to make the decisions. So do your homework, weigh the pros and cons of each and every option that's given to you, and then take a decision. Thanks, and wish you all the best in your journeys.
Thank you so very much. I just want to say it has been actually shown in studies that women who have support survive twice as long as women without support. So please do reach out and please do lend a helping hand when you know somebody has either breast cancer or any cancer. It's up to us as a community to reach other folks because we're all in this together and it is just the right thing to do. So with that, thank you, Anusha, so much for sharing your journey and your story. Very encouraging, and thank you very much. I would like to invite Laura at this time. Laura is a two-time cancer survivor of ductal carcinoma in situ, diagnosed at a very early age of 33. And because of her young age, she was not given prophylaxis, preventive treatment. And she shares her journey with others by reaching out and providing encouragement and support and hope. She has chronicled her journey in a book called I Stuffed My Bra, So What? A Beauty for Ashes Journey. She gets to share she wants and gets to share her story with anyone and to offer insight and support. She is very thankful to Lopa and Breast Cancer Hub, and we are so thankful to you, Laura. So would love to hear your journey and your story and your words of encouragement to everyone. Thank you.
Hi, Dr. Padma. Thank you so much for the introduction. And again, I am very grateful just to be here to share my story. So as Dr. Padma said, I was diagnosed at 33, and because of my dense breast tissue, they would not give me a mammogram, but I knew something was not right. I just felt it in my body that something was going on. I just didn't know how to address it, And so, but one thing about being in the Black community, those are things that we just don't talk about, cancer diagnoses, death. We just kind of brush it under the table or under the rug and we don't discuss it. So I didn't advocate for myself as much as I should have. But then after this, towards the end of the second year, I just kept asking for a mammogram. And finally, my primary care physician finally gave me a referral to get a mammogram. And so it was detected in the mammogram that they found calcium clusters in my breast. And so after them taking some samples of tissues, it was discovered that I did have DCIS, which is ductal carcinoma in situ, which is breast cancer in the milk ducts. So, excuse me. So I was scheduled immediately for 36 rounds of radiation as well as a lumpectomy. But during my diagnosis and talking about surgery, there was so much information and it was very overwhelming. And my kids were really small, and I had my 4-year-old daughter sitting on my lap, you know, while they were telling me my diagnosis, while they were telling me my life expectancy. And so it was a lot to take on. And I know I had a support system, but at that time I just hadn't tapped into it. So throughout my first diagnosis, I kept it really quiet, even from my kids. And I heard that Anusha said, Dr. Lopez saying, talk to your children. But again, in the Black community, not only did we not discuss it with the adults, we didn't talk about it with the kids as well. But by the time I was going to reach my 5-year mark, which is considered cancer-free, you know, I had done tamoxifen for the 5 years and my radiation and everything. And when I thought I was done with everything, they found it again. So they found more calcium clusters in the same breast. But this time I just decided let's do a mastectomy, because I didn't want to feel like a guinea pig. And so by this time, my kids were older, and I told them exactly what was going on. It's best that they can understand, you know, because they were probably the age of 16 down to the age of 9. So to try to explain that to the smaller ones was a little hard, but we just said that mommy had an owie. That way they knew to be careful, but at the same time, they weren't wondering why were so many people at the house, or why was she going to the doctor, or why I was sad. And so with the second surgery, I ended up doing, like I said, a mastectomy, but I also opted for reconstruction. But going back to what I think Dr. Lopez said, that sometimes some doctors don't give you the options. They kind of, depending on who your provider is, they give you so much information, but they don't say that there are other options other than death, you know, because like Dr. Lopez said, when you're first diagnosed or you hear the word cancer, you immediately think of death. And so that's what I thought of. And most of the information I was given was my life expectancy, you know, so, but there were any other options, like your life could be prolonged if you do this or that. So just moving forward, after my mastectomy and reconstruction, the reconstruction lasted 54 hours. And I was told after 48 hours with reconstruction, because I had a tram flap. And for those who don't know what a tram flap is, it's when they take the belly fat and they create you a breast. And so I was told after 48 hours, if it lasts, then I should be okay. But after 54 hours, the pulse in the breast, in the tissue, it died. So they had to go back in for about 9-hour surgery to try to save the breast, if you will, or save the tissue. And it didn't last, and it just died off. And then, so since then, I've just opted not to do any more surgeries, but that taught me something, that it's good, as Anusha said, to advocate for yourself, you know, do your research and know what you're getting into. Now, the second diagnosis, that particular doctor he gave me more information. So that made me feel a little more comfortable about asking more questions. But initially, the first time, I didn't feel comfortable, and I was not forced to ask any questions. But thankfully, the first diagnosis, my mother was alive. On the second diagnosis, she had already passed away from cancer as well. So I didn't have her, but I had a really good village or support system around me. So I just want to say, to, you know, being a survivor now, a 2-time survivor now, it really pushes me to encourage others who are going through it. And I have friends that have been diagnosed recently, and they get afraid because the first thing they think of is death. And most of them have children or small children. And so they're afraid to advocate for themselves. So I try to encourage them to allow me to either go to the doctor with them or be on the phone with them, so that I can hear what's going on. Because most of the time when you go to the doctor, especially for a cancer diagnosis, you're not thinking these particular questions. You know, your mind is overwhelmed, you're thinking of other outside things. And so I try to teach ladies and men and women to write it down. Just write down your first 5 or whatever it is, because you only get 10, 15 minutes with the doctor sometimes. And then when you're gone, that's when all the information starts to flow. And then those are all the questions you wish you had asked. And so sometimes we don't want to say anything because we just don't know. And like Anusha, as well as Lopa said, educate yourselves, find out what's going on with your body, because I knew something was wrong, but I didn't know what to call it. Because again, at the age of 33, like Lopa said, you know, they tell you at 40 to go get a mammogram. Well, I was 33 years old. So had I waited 7 more years, I mean, I may not be talking to you now. So, and it's not easy, you know, it's not easy to do all the research or to ask the questions, but it's just always good to have a support system. And it's not comfortable, but it's a conversation that we do need to have. And like I said, especially in the Black community and here in the United States, a lot of times we don't want to talk about it because we think if we don't talk about it, it'll go away. And as Dr. Lopa was saying, I want to break that taboo as well. The more we talk about it, the more comfortable we'll be talking about it, because it's not just us, it's our sons and our daughters. And cancer is very rampant in my mother's side of the family. I have aunts, uncles, her sisters and brothers have died from different types of cancer: lung cancer, brain cancer, pancreatic cancer, you know, it's all of that, you know, so we have to talk about it. So I do talk about it with friends of mine in my community. And I'm also an advocate for another agency. So when they get, you know, anyone that gets that diagnosis, I get on the phone and I just try to talk, just to hear what they have to say. Maybe they just want to talk and cry, and that's okay. Because I'm not a doctor, but I've been through it enough to where I can give some answers, but I also encourage them to get the answers for themselves as well. And so also one more thing with like caregivers. I don't know if there's any caregivers out there, but just know that you have to take care of yourself so that you can take care of the patient. You cannot become the patient as a caregiver. And I know sometimes it's hard, especially if it's a spouse or a child of yours or someone else that's really close to you. But it's very important to take care of yourself so that you can help them get well. Because if both of you are laying in the bed next to each other, unwell from different maladies, then it's harder for the real patient to get better. So again, I am very thankful to just share my story. You know, being a 2-time cancer survivor does not make me any better than anyone else. I still have my struggles once in a while when it's time to go get that mammogram. But this last thing I'll share, I got my letter and I shared it with Dr. Lopa. I finally got my letter that after 20 years of going for mammograms, every 3 months, having all these different MRIs and different stuff like that, that I no longer have to go to the oncologist every year. So now I still have to do my mammograms every 2 years now, but I'll still do them every year just because of the history. But after doing all that for 20 years straight, I no longer have to have an oncologist or anything like that. So I am very grateful. And as Anusha said, I wish you all the best. And again, thank you. I'm so glad to be here.
Thank you, Laura, for your amazing story. I'm sure it is going to inspire a lot of people to be proactive and to stand strong. With that, Dr. Padma, I would like to request you to invite the question answers session open. Or also, did you want to bring Radha on to the stage and have her say a few words if she's
Yes, because she is with the Lopa Mudra's program. So she would just like to say a few words. Kamala.
Yeah, thank you. I just wanted to say thank you so much to Dr. Lopa. It was just such a fantastic opportunity to work with you and learn from you about your work. It was really, really inspiring. And it was great to hear about about the presentation today and hear everyone's stories. It was, yeah, so just thank you.
Thank you so much, Radha. It's so great to see you. It was a surprise you coming in. I didn't know you were there. Thank you. Means a lot to me. You know, my students are, I mean, I just love my students. So
That is one thing about training future scientists, and that's so much needed. So I just have a few things to say. So about the different lifestyle choices that we make. So there was a lifestyle, there was a large study of over 1 million people. It was a meta-analysis done by Stephen Moore and was published in JAMA, where people who exercised actually developed less cancers than people who didn't. So I think exercise has not only therapeutic value, it also has preventative value. And the other thing I wanted to say is about food. The World Health Organization has shown that if you cut down red meat intake, you can actually halve the incidence of breast and colon cancer. So just that one change, reducing red meat intake, decreases your breast cancer risk and your colon cancer risk significantly. The other thing is we talk about wonderful foods here like Brussels sprouts and broccoli and berries, etc. But if you go to a poor country like India, I mean, first of all, berries are not often found, and broccoli and Brussels sprouts are not in the diet. So what shall we do? Of course, we have cabbage and we have cauliflower, which are, readily available, but we also have wonderful things that is available to every Indian. Moringa leaf. Moringa leaf is so packed with nutrients and anti-cancer. It is now being investigated here, and in mice studies, they always do mice studies before people studies, but mice studies, it shows it can prevent a variety of cancers, including breast, pancreas, lung, etc. So it has strong anti-inflammatory and anti-cancer activity. The other one is amla, which is also known as Indian gooseberry, effective in mice, again, in the lab, in test tube, against triple negative breast cancer, brain cancer, lung cancer, pancreatic cancer, and you name it. But amla is part of our food for thousands of years, and there's no toxicity that is associated with that. So just include it as part of your diet. And also pomegranate is so readily available in India, and I think for a much longer period also. And pomegranate is a wonderful anti-cancer food. It prevents genotoxicity. It prevents mutations that form cancer. It is also effective against wide numbers of cancers. And spinach has lutein, zeaxanthin, and folic acid, and fiber, healthy fiber. So spinach is, again, a very good food. So there are a wide variety of foods that we don't talk about here, but it's available to even the poor in India. So one other thing, we talked about community support, which is crucial and has been shown in studies to prolong survival in people who have the community support. The other mechanism it acts by is actually stimulation of the vagus nerve. When people have community, when support, and when they are with friends and family, their vagus nerve is stimulated, and that really it stimulates the parasympathetic system, which is the anti-inflammatory system. And the other ways that you can stimulate your parasympathetic system via the vagus nerve is meditation, deep breathing, which we call pranayam, just deep breathing. And University of North Carolina has actually shown if you do 10 minutes of deep breathing twice a day, just 10 minutes twice, it decreases inflammatory markers in your saliva. So it's easy to do. And so 10 minutes twice a day. And also the other interesting thing is being kind. When you are kind to people, not in a vast, major way, just like simple things, or chatting up, or offering a hand with groceries, or opening the door, some kind of interaction and kindness, it shows that it dampens the inflammatory genes and improves your immune genes. So these are simple day-to-day activities that you can boost your immunity and cut down your inflammation. So with that, I will turn it back to Vidyangi and myself, I guess, for Q&A. So we have 3 questions here.
Yeah, I think Dr. Padma, you have answered them. You have typed the answers. You can probably vocalize it for the benefit of others. And Dr. Lopa, you also have a question you want to answer in detail. So maybe Dr. Padma, you can go first. And
Oh,
then
the two questions I answered, they're not here now. But anyway, one was
breast cancer in men, how is it
yeah,
detected?
breast cancer in men, how is it diagnosed? It's the same way as in women. I mean, if you notice, so the men have to do a kind of breast exam too, be aware of their body, and if they find a lump, then they have to talk about it, bring it to the attention of the doctor, know that breast cancer is a real thing. And then subsequently, it's a clinician's exam and a mammogram and a biopsy and all of that. Not only just feeling a lump, or if there's a discharge, so if skin changes, so any of that, it's similar to, men have very tiny amount of breast tissue, but it's similar to cancer in women. Lopa, do you want to add something?
No, you were spot on. So basically, it's the same screening process, mammogram, and if needed, we go for ultrasound, and then of course biopsy that will determine if it's actually malignant or not, or what is the tissue type.
Right. Also, there was a question about CT scanning being used in detecting breast cancer, and when can it be used, or can it be used?
It can be used for detection of metastasis, but not in use of detection. We have mammograms and we have sometimes MRIs, we have ultrasound. So we don't use CT scan for detection, but for evaluating, for staging perhaps, and for evaluating metastasis, definitely.
Right, great. So with that, Dr. Lopa, would you like to take Rini Shah's question?
Yes, yes.
She
I
says,
think she had 2 questions, right? Vidyangi, would you like to repeat the questions that we want, those 2 questions?
sure. The first question was, I was reading some news about mammogram linked with positive breast cancer. Is there any risk in getting mammogram done?
Yeah. So basically, Rini, mammogram is low dose radiation, right? So there's always a conflicting data. So some research say that in the long run, being exposed to every year mammogram, because breast tissues are very soft and delicate, so it may also lead to breast cancer. But that risk, I would always say that we should always negate, what is more important, because until and unless we do a mammogram, we won't be able to detect the cancer early, which is more fatal than thinking of the risk that, constant exposure can lead to, because that is very insignificant too, because the research is still going on. There is a conflicting research. But I would say this, that if you have dense breast, then instead of going for the mammogram, you can go for ultrasound, which doesn't have the radiation, what you are thinking about. So because if you're having those doubts in your mind, I always say that, because in addition to the mammogram, anyways, we have to do the ultrasound. For the follow-up, you can go for the ultrasound to be on the safe side if you are thinking that, this is a concern for you. But the first time, you definitely should go for the mammogram, and especially the 3D mammogram. But additionally, you can do the ultrasound.
Awesome. Thank you for that, Dr. Lopa. I have a borderline osteoarthritis. How much increased risk factor can that be, and how should I manage it with lifestyle changes?
Yeah.
This may be.
So
Okay, go ahead.
this is a very good question, Rini. So basically, as I said, my work on rheumatoid arthritis and breast cancer, we found a correlation. But in that correlation, what we found was that because of arthritis, the breast cancer did not develop. But when we have arthritis and the breast cancer has, so we did it both ways, the experiments. So when we have breast cancer, at that point, if you already have chronic arthritis, then it is like, it helps with the progression of cancer faster. So how do you curtail this arthritis, osteoarthritis also? You have to that's where Dr. Padma said, the lifestyle, getting into the anti-inflammatory diet. I have an article written on anti-inflammatory diet, and I can send it to the CWC forum to be shared with you, or you can directly reach out to me. Everything is also posted on our website. So looking into the diet part, rich anti-inflammatory diet where berries, cheese and all the other products that Dr. Padma mentioned. And of course, I always say that turmeric with the curcumin byproduct with the pepper plays an important role. Then garlic, fresh garlic in the diet, and those things are important. Plus, exercise will really help to curtail the inflammation and then like boost the immune system. So these are the different lifestyle changes you can make, which will be very helpful.
What is the diet for preventing cancer or reversing it at the beginning of pre-cancer?
Loma Linda University did, they followed, I think, close to 100,000 people or 90,000 people. These were all Seventh-day Adventists. And Seventh-day Adventists are really, very health conscious. They exercise, they eat right, etc. So they did a long-term study. It's called Health something. Anyway, it's by Loma Linda University of Seventh-day Adventists. And so they divided these thousands of patients into three categories. One was on their usual diet. The other one was a vegetarian diet. They were vegetarians. And the third group was vegans. And what they found out was the vegetarians had lower levels of any intestinal cancer, which means it starts from your gastrointestinal, it starts from your oral cavity all the way down to your rectum. So any of that, they had less of the vegetarians, whereas the vegans had total overall lower risk of cancers. So what is the best diet? I guess vegan diet. But at least what we can do is reduce red meat intake, eat mostly organic, and do all the other things. Eat cruciferous vegetables and garlic, onions. One thing about eating garlic is we tend to overcook garlic and onion. We put it in stuff and then we boil it, and we shouldn't really do that, because like garlic has this enzyme called allicinase that converts the compound, the parent compound called allicin to allicin, which is the effective anti-inflammatory cancer protecting compound. So if you boil or cook the garlic, you are destroying the allicinase enzyme. So if you want to use garlic, which you should chop it, leave it outside for 15-20 minutes, so this allicinase will convert the allicin to allicin. So that's a little bit more stable compound. And then lightly saute or add it at the end of your cooking. And similarly with onion, instead of chopping and doing the masala and boiling everything, and putting everything in the Instapot, you really are not going to get your nutrients. The other thing about cruciferous vegetables too, they have the myrosinase enzyme, and it will be destroyed if it's overcooked. So steaming gently, cooking gently with these sensitive vegetables, and that is the best way of preventing, having proper foods, avoiding damaging foods, being mostly vegan, and eating our healthy foods in a less traumatic, less cooked form. Long-winded answer.
Yes, I think that was a very comprehensive answer. You summarized these important issues several times during this webinar. Dr. Padma, thank you for that. It is etched in our minds. Thank you so much. I have with that the next question. What do you think about the liquid biopsy early detection test? This question is from Mohan Uttarwar.
Yeah, so very good question, Mohan. So the liquid biopsy test, I myself worked on it for many years. We tried to develop a novel antibody in the lab. So I would say that like we have many, like CD153 and all of that. So I wouldn't go that for the screening yet for breast cancer, because many times we have seen that false positive or false negative with the liquid biopsy, because the sensitivity and the specificity is not like 90 to 100% yet. So that's why, but liquid biopsy, like, these molecular markers work that, for example, if we have one marker, which we know that we have cancer, we are trying to detect it, it's coming as upregulated, then we are going through the treatment, we are checking the marker again. This becomes a parameter like, okay, if the, our condition, our cancer situation is working or not. So that way, if the treatment is responding or not. At that point, I would say is very important. But for screening purpose, there are many liquid biopsy tests. I myself worked on it. So I always want to be very transparent and say that there are tests, but they are not 100% specific and sensitive. So with cancer, we cannot take the risk. So it's better to go for the screening and then for the biopsy till we have something which is very specific, which gives us the 100% confidence in future.
Right. That is great advice. Do not compromise on testing. Do not compromise on early, adoption of techniques, for prevention and for detection. So great advice. There are two questions related to, dense breasts here. I'm going to combine them. One is if you go for 3D mammogram for dense breasts, and if it comes negative, do you still recommend ultrasound? The second question is chronic endometriosis along with extremely dense breast tissue, but no family history, associated with increased risk of ovarian cancer?
So basically, 3D mammogram is to identify if there is any lump or not, right? So if we know we have dense breast, then you can, in India, a lot of times what we do is we suggest, okay, just go for an ultrasound as a follow-up. In the US, that's not applicable. Like, for example, I myself have severe dense breast. Each time I have to go for a 3D mammogram because the insurance covers that, or mammogram. And then after 2-3 times, then finally I'm doing an ultrasound, which I keep saying that why can't we just do an ultrasound? Because I know that finally I'm going to do that. So because of the insurance policies, I'm facing these challenges. That's where the healthcare change policy that I was talking about that I'm trying to work through. But if you're in another country, then talk to the doctor and then tell them that I already have dense breast. Do you think I should do a follow-up mammogram or ultrasound should be enough? So I leave it to the discrepancy of your attending physician, because he will or she will do the clinical breast exam. But for screening purposes, many times now in India, what happens is many places mammogram machine itself is not there or it doesn't work. So ultrasound is of course a better option. So you can definitely go ahead and do that.
Great. And the question about is chronic yeah.
Endometriosis, right? So yeah, very good question. So endometriosis, lot of times study is going on that it doesn't have a correlation with ovarian cancer. I myself, I'm a victim of stage 4 endometriosis. So I'm still fingers crossed. So I did a lot of reading on that. And it says that we will not die of endometriosis, but we will suffer throughout, because of the scar tissue formation. So a lot of research is going on. It's still conflicting, but I would say that many times if you go to the doctor, they may give you a lot of hormones to stop your period, because at that point the scar tissue will become shrink, it will shrink, and it's basically that's another way of treatment. But I totally leave it up to you whether you want to do that, or menopause is the best way. You finally recover from endometriosis because that developed during the time of the period. But there's not much correlation. And I haven't read anywhere with the dense breast and the endometriosis and ovarian cancer. So if I haven't read it or I do not know, so I don't want to comment on it. But with ovarian cancer, again, it's a conflicting data, but a lot of times they say there's no correlation. But hyperplasia is important. You should go and check with your ovary and uterus, because when you have endometriosis, I always advise that please do an ultrasound every year of your ovary, so that you keep a check of anything going on, then of your, the uterus and all of that. So that is important. So do an annual ultrasound. That will be helpful for us to identify if any abnormality is going on or not.
We have one last question from Purnima Jain. She asks, my two elder sisters already have been treated for breast cancer. So what is it that I have to take care of for myself?
No, see, Purnima, it's very important that you do the BRCA testing. That would be like the first thing. Where are you located? Are you in the US or in India? So if you're both the places, we have this genetic testing. So if your both sisters have been affected with breast cancer, I would definitely request you to do the BRCA testing. But also there are other high penetrance genes that I mentioned, and also the moderate penetrance genes. So we shouldn't be just doing the BRCA mutation test, but the other panel. And anytime once you do the testing, I'm always there to make you understand the report and analyze and help you what to do next. Based on your test, we can decide what preventative measures we can take.
So Bhakti has a follow-up here. If the BRCA test is negative for my sister, do I need to get it done?
Oh, so it's negative. But then did you test for other genes that I mentioned besides the BRCA?
No, he says no.
Okay, so probably there is a panel and we can talk offline, or you can talk to your doctor that if you can do the full panel of the genetic testing. Because if both sisters are having, I'm a little concerned that that cannot be a coincidence, that both sisters are having breast cancer. So please ask them to do the panel, or you can do the panel. So that way, if yours come positive, you get an answer that maybe theirs may be positive for some other genetic mutation too.
Yeah, to err on the side of safety. It's always good to err on the side of safety. So great, she thanks you. There were a lot of great comments about the presentation, and we have someone congratulating health heroes who have fought stage 4, cancer, and they say it has been truly inspiring, the stories as well as the presentation. Thank you for that, audience. We really appreciate your feedback. So this is great advice, a great panel. Again, thank you, Dr. Lopa and Dr. Padma, for this amazing and informative session. Both of you are an ocean of knowledge. I think you can go on, and both of you are so passionate. Dr. Padma, amazing insights on lifestyle medicine. Dr. Lopa, I cannot even begin to think where and what part of cancer you're an expert, and you covered so many topics. We are fortunate to have both of you amongst us tonight.
It's
And
an honor to be with Dr. Padma and Laura and Anusha, so.
Yes, and not to forget this amazing, bold narration of their life and the fight through cancer by Laura and Anusha. We are truly grateful to you for coming on this platform and inspiring all of us with your story and heroic, the way you fought your challenges.